Believe it or not, I've been censored again. I try my best to stay within the professional guidelines, but I can't help it if people have got the science around COVID wrong. I don't know how to phrase it, I don't know how to frame it. I'm not trying to get people upset, but the reality is that if you don't acknowledge the flaws in the science, you can't mitigate the outcomes. And remember, these are real people at the end of these errors. People are affected, people get sick. This is not just an opinion. And so I'm not surprised that many in the scientific community are really upset and really keep on focusing on my content. But the reality is that I have a responsibility to keep challenging them. Because if their only way of getting around what I'm saying is to censor me, it suggests they don't understand the science because they therefore can't explain it. Well, this is the latest round, and this time I don't blame LinkedIn because their report. Someone would have reported me. I suspect I know who may have, but they have reported my content truthfully because it upsets them. Here is what it says. Only you can see this post because this image or other media doesn't comply with our professional community policies. Essentially, what had happened is that I spoke about a scientific paper around changes in the lungs that was delayed for about 4 years. And that recently published radiology paper with imaging from early 2020 confirmed that vascular abnormalities, not airway inflammation, was the dominant feature in severe COVID cases. Now, you may think, well, why would anybody be upset with me saying that? It's because of the implications. And as I said, anybody who understands science and understands physiology will know that what you don't mess around with is autoimmunity. And if you are seeing involvement of lung blood vessels where there are cytokine responses showing an overactivity of the immune system, and you are getting clots in those blood vessels, and you don't consider vasculitis, I mean, that's horrific. So, vasculitis is just inflammation of any blood vessel. But in this case, in severe COVID-19, I'm saying that it was the primary pathophysiology for the disease. The reason it's so important is because your treatment would have been very, very different. Lives could have been saved. And as I said, interestingly, one of the few people in the world who treated this like a vasculitis with high-dose steroids and antihistamines was Dr. Chetty. And you know what his outcomes were? Over 14,000 patients seen and 0 deaths. Imagine if this was understood, because the treatment is not complex. It's pretty straightforward. We treat autoimmunity and vasculitis all the time. This is not some weird and wonderful thing. That's what rheumatology does. They have a whole range of drugs that they use to treat this kind of condition. We had every tool in the toolbox. You just needed to know that it could have been used, the right dosing, the right timing, and lives would have been saved. But here's what I'm realizing is that science seems to nowadays be more about ego. It seems they're not interested in your health. They're interested in maintaining their position, maintaining their standard, maintaining their credentials, not actually getting answers. And what's worse, it seems as though the realization that there could be errors, instead of an apology, instead of saying, okay, maybe we got this wrong, we could or should have gone this way. No, there is a persistent view. We can't get it wrong. We have to be right. And we don't care what the outcomes are. Now, we know and understand this in terms of medicine. And the truth is that all of us as medics naturally have some degree of ego. And it's just the way medicine is practiced. It's a strange thing. I can share the fact that, sometimes you think a patient has a diagnosis, you've done the investigations, and then they come up negative, and you go, darn, how did I get that wrong? Instead of saying, thank God they didn't have that wrong. So there is a degree of ego naturally in medicine and science. Everybody wants to be right. And we're sometimes dealing with some of the brightest people who are used to being right. But there are times when it's important to put that aside for the sake of others. And this is one of those times. So I keep a record of these periods of censorship because otherwise, when hopefully the litigation comes full circle and they realize that, oops, there are people who were saying this, they can't say they didn't know. I've got a record of it. So this is why I keep a record of these cases. And as I said in the link, you will see the full bit of the description of the video and the article that I made on Substack about this, because this is what really is dealing with the issue, real cause of severe COVID-19 buried. This is where I deal with the whole situation as to why it was so important. And this is what I was driving people to read the full article and get a link to the paper, the PDF. And this was the image that I used on LinkedIn that got me censored. It's what I call inconvenient science. The paper was delayed 4 years. It wasn't that it wasn't they had written the paper in 2020, and it took 4 years for somebody to publish it. And all they were saying is that the radiology suggests it's a vascular disease, not a viral pneumonia. This gets censored. And so you realize that we need to get to a point in science where we are able to address the huge issues that are facing us. As I said, and I keep, because I'm going to appeal it, but I have no idea if they're going to agree. There. Sorry about that. If you missed that, some of the comments that were there are showing you what people were thinking. As usual, yes, somebody was thinking about post-COVID DVT. Makes perfect sense because the blood would have got hypercoagulable. Pulmonary embolus wouldn't surprise people. And you can see this is why the majority of people put on ventilators died, of course, because no matter how much oxygen you gave them, you couldn't get it through. And so these are the things. This is when diagnosis follows dominant narratives instead of silent truths. Treatment is delayed and direction is lost. Medicine advances not just by asking the right questions, but by daring to ask them at the wrong time. Beautiful. This guy must be a poet. So you have all of these responses here. And I realize that it started to get people worried. Too many people were making sense. Too many people were connecting the dots and realizing that this is important. This is very, very important. And so it seems that rather than addressing the question, they then decide to censor the content. Well, what can I do? I still have to talk about it because even if I was only talking to one person, I'd still be doing the same thing because it's too important. Autoimmunity is the beast that we don't want to face. If we are driving autoimmune disease because of mechanisms around severe COVID, you have to acknowledge it at some point because it would explain why so many people are getting sick and they don't know why. Autoimmunity is a great imitator of every single condition, It is the nightmare. And the worst part is we can manage autoimmune disease, but we cannot cure it, not at this time. So the reality is that we are facing huge challenges and we need people to look at things in a different way. As I conclude this, I'd like to remind you that I'm taking on another one of these very complex topics with regards to spike protein and mad cow mimics. This one is really going to get the scientific community alarmed because it is so serious. Should I talk about it? I think so. I've been sitting on the information now for 4 years, and I think it's probably about time that we have a big discussion about what the longer term implications should be. So if you're interested in that, make sure to look in the description. As well, make sure if you want to see this whole post about what's getting the scientific community so upset, again, that's there in the link as well. Real cause of severe COVID-19 buried. Let's continue to ask the hard questions because they are important and we have a responsibility to find as many answers as we can. Have a great evening. Look forward to sharing with you more information in the near future.